Hi, I'm Dr. Gary Motykie, and I'm a Beverly Hills board-certified plastic surgeon. And today we're going to talk about Mike Jeffries. He is a 77-year-old gentleman who was the CEO of Abercrombie and Fitch from about 1992 to 2014. He became very notorious for creating kind of this sexy American brand. And then he also became notorious for only hiring also workers for the brand that were also very sexy and attractive. We're talking about this topic today because there was recently a documentary released on Netflix about Mike Jeffries, about Abercrombie and Fitch. I think it was called White Hot, The Rise and Fall of Abercrombie and Fitch. So in the documentary, they talk a lot about these topics, that he was obsessed with sexy image and having the employees looking sexy and attractive. And then allegedly that he had undergone multiple plastic surgeries himself. So we're going to take a look at kind of him throughout the years and decide for ourselves if we think he's done plastic surgery. So before we get started, there is some chatter on the internet, I guess, that his most recent photos that Mike Jeffries kind of looks like a goblin. Also, they said he kind of looked like the character out of the movie Mask. There's been Biff Tanner from Back to the Future, and also some of the cat character from Stephen King's The Sleepwalkers. So not very nice comments about his appearance. I think the overall message is he might be looking a little strange. So what do we speculate he's done? Other people have speculated that he's done multiple surgeries, including like his eyes, brow, possible facelift, chin, fillers, all kinds of things. So we're gonna look back at when he was a little bit younger and analyze his face, and then now when he's a little bit older and see what we think he's done. So if you look at Mike in his 30s to getting into his early 40s, not really much there. Looks pretty normal. Doesn't look like he's done much of anything. Normal aging, kind of a thin, longer face. Does have somewhat strong chin features, but nothing out of the ordinary. As we get into later in the 40s, we start to see a little bit more poofiness in his face. Now, could be weight gain, could just be some aging, but you do notice that his brow is a little bit lower, that his chin got a little bit stronger. Now, he does have a dimple in his chin or cleft, and you see that didn't change. Now, interestingly, even if you do a chin implant, it does push that cleft forward, so that wouldn't have changed if he did a chin implant. But it is a little suspicious for things like typical things of that age, Botox, fillers, and possibly maybe a chin implant. I will comment though, in those photos though, he does still have his 11s there. So if he is, he's doing more minimal stuff at that age. So if we move a little bit forward into Mike's 50s, starts to look a little strange. And I think some things are pretty obviously changed here as far as really suspicious for surgery. We see that his complete expression and eye shape has changed from 10 years before then. And particularly of notice is that his brow is really smoothed out, and the tail of his eyebrows has been raised. So those 11s are gone, brow is very smooth, tails are raised. All of those are very suspicious for brow lift. And usually I typically say I don't recommend that in a male patient, and the reason is it can make him look feminine and strange, and he looks a little bit feminine and strange. I think it also looks like he may have done his upper and lower eyes, because you see underneath his eyes that the skin under here has been pulled and looks completely different. So I'm suspicious again that he may have done something to the lower eyes, remove the bags, tighten the skin, as well as the upper eyes along with the brow lift. Then if you look at his face, you can see that it's pulled. The vectors you see looks like it's been lifted up like this. And again, it looks really well in a female patient or somebody that wants to look feminine, but again, it's giving him a feminine look. He looks pulled, he looks poofy. All of those, again, I think is suspicious for a facelift. And then we look more towards his lips and his nose area. His nose, not a huge change here, maybe slightly changed, but his upper lip is definitely fuller. So that's a little suspicious, possibly for a little bit of a finesse rhinoplasty along with an upper lip lift to make it fuller. And if not, or in combination with fillers into the lips to make them fuller. Also think his jawline looks more defined. So again, that would be something that came along with the facelift. And his chin looks, you don't see the cleft as much there, and it's a little softer. So again, maybe fillers or possible chin implant in that area. So I think at this point, really suspicious that he's undergone multiple surgeries. So now if we move into Mike's 60s, he may even look slightly stranger if possible. I think one thing to note from here is some of his previous surgeries may have settled a little bit in the brow area, because the brow doesn't look as pulled up and his eyes don't look as slanted up. So that may have settled a little bit in that area, but you again can see how the upper eyes probably had surgery as well as the lower eyes. And in his face, it looks like a facelift that, again, that was disjuncted. In other words, you can see differences between his neck and his jawline and his face that weren't blended very well. So again, I'm very suspicious at that point of a facelift. Obviously, he has new veneers. And I think just in an overall view of him, again, it's something you don't want from male surgery or any sort of surgery, female as well. But in him particularly, you don't want to end up looking strange, which is ironic because he was so obsessed with sexy, attractive people throughout his career. And then he ended up trying to emulate that maybe with plastic surgery, but it didn't quite go in the direction he wanted. I'm not picking on him, but in general, it's something you should avoid. And I think we're going to go through a little bit now, maybe what could he have done to avoid this, or why does this happen? But in general, he hasn't really been seen since then. So maybe he did some work to correct it. We really don't know because there's not too many photos of him after this period in time. So again, one thing I want to say about Mike Jeffries is never break the golden rule of plastic surgery, which is don't make things worse or weird. I will say he's not alone. So if you look at some other patients that had similar problems to him or similar surgeries to him, some people that come to mind would be Mickey Rourke, Burt Reynolds, and Joe Biden. All of them, again, have that lateral pull to the face, the eyes a little bit overdone, and some of those strange expressions that we pick up on almost immediately. And again, it's, I tell people, particularly in men, underdo it, never overdo it. Then you don't risk looking like them, pulled, overdone, and strange. I think it's, again, maybe an older technique where the surgeons maybe were doing more of a female facelift on a male patient. And unless they want to look like that, they're going to end up looking feminine. So that's why I really warn male patients, stay away from that and make sure you go to somebody that's experienced in doing a male facelift. All of this that happened to Mike and these other famous kind of wealthy actors and politicians always begs the question of why does this happen to rich people? Why, if they have all the money in the world, why do they get bad plastic surgery? And it's an interesting question, and I think it has somewhat to do with just because they're rich and wealthy doesn't mean they understand the cosmetic surgery landscape. It's a complex arena. They get duped just like the rest of us. And I think on top of that, they're prime targets. So in other words, they have money. So they're targets for unscrupulous doctors. Typically what will happen sometimes is they'll go to a good surgeon, a skilled, ethical, experienced surgeon. He may tell them, no, I don't think that's the right surgery for you. You may end up looking strange and pulled. And they don't like taking no for an answer because they're wealthy and powerful. And they go to find somebody that can do the surgery. And usually that may be a little less, scrupulous doctor, maybe little less experienced, but's willing to take the money. And I do see some of that happening. And oftentimes they even travel to other countries to do that. So I wonder if it's almost a curse of the money that they don't like to take no for an answer, and they have the money, which makes them prime targets for bad plastic surgery. And then secondly, I think there's a bit of a two-way street here. Wealthy patients sometimes aren't the most compliant patients. Sometimes they're not in the best health. Sometimes they're just not, they don't like to take no for answer. They don't like to follow the doctor's advice. And so it may be a two-way street that they also, in the follow-up, they're traveling a lot, they're moving around a lot, they're not following up with the proper post-operative routines and instructions from their surgeons. So there may be a mixture of that, because what that can do is lead to complications, poor healing, and poor outcomes. Complications and strange looking appearances. So it may be a combination of all those things, but I always wonder about that. And when I oftentimes see people like that, you will hear stories of them getting botched and sort of taken advantage of. And then once that's happened, like I warn everybody, once somebody's overdone and overpulled, it's very difficult to undo it. So they're kind of stuck that way. I think that's why I'm trying to tell people in the beginning, be very careful, particularly in men. Don't overdo it. Don't get overpulled. Don't get that feminine look if it's not what you want, because it's very difficult to undo. So if these surgeries are very difficult to undo, how do you avoid getting it overdone in the first place? So what I like to tell people is research your doctors. Look at their training. Look at their aesthetic sense. Look at their experience in doing the exact procedure you're interested in doing. Secondly, you want to listen if a credible surgeon tells you no. In other words, maybe listen, there's a reason they're telling you no. Or if multiple surgeons maybe tell you no, this isn't a procedure for you, don't seek out then somebody that's going to say yes. Thirdly, avoid extreme surgery. I've said this multiple times. You can always do more, but it's difficult to undo. So try to avoid doing those really extreme surgeries. And then I think what you can do is play a part in it. Just like I said, keep yourself healthy. Make sure you're giving yourself the best as far as health during recovery, before surgery, after surgery, during surgery, all of those time periods, so that you will heal as best as possible. And then lastly, try to listen to your doctor's advice, do your follow-ups, be compliant, because all of those things the doctor's trying to help you heal properly. So I think if you follow all of those kind of guidelines, you really lower your risk of A, complications, but also B, ever looking strange, pulled, or overdone.
You named a few male celebrities that you thought didn't have good work done. Are there any male celebs that you think do have good plastic surgery? I know one that you could name.
Yeah, but you don't know because it's so good. That's the thing. The real goal is for most people is not to give the secret away. That they do plastic surgery, they want to look better, they don't really want people to know what they did, they just want to look like a better, younger, more attractive version of themselves. And if once you get pulled and strange, you already gave your secret away. So a lot of actors and famous people that have had good plastic surgery, you don't know because it looks natural.
Last question is from your viewers. Do you want to tell them about your facelift?
What do you mean?
Everyone thinks you had a facelift.
No, I do the taping.
Oh yeah, like Bella and Deep, yes.
No, I haven't had a facelift.